Morning, today is June 3rd, 2025. Present right now with the Health Department is Pam Hanna. With that being said, Pam, would you like to lead us off, please?
Thank you. I usually kind of lead with what's going on with communicable disease. And right now it's measles, not in Jefferson County, thankfully. However, it is spreading statewide. There are now 15 cases in Montana. We haven't had cases since 1990 until April, when Gallatin had their first case. So Gallatin has 10 now. Flathead has 2, and Hill has 3. So what our concern is, and Canada and Alberta has almost, I think, 600 some cases now, and North Dakota has 32. So our concern is travel. You know, it's summer and people will be traveling to and from, going and getting it or bringing it here. So we really are kind of trying to get some messaging out. The good news is measles is highly contagious, but it's also highly preventable. 2 measles doses is 97% effective. And it's a long-lasting vaccine. It's not something people have to have boosters on, or, you know, that it wanes. So we've been trying to get some information out. In fact, the newspaper, the Monitor, reached out to me and asked if I'd give some sort of a statement because of the increase in Montana. So that should go out in this week's Monitor. But FYI, that's our big thing. Other cases of communicable disease have been pretty slow. We did get 1 case of COVID this week, which has been the first one in quite a while. Flu is pretty much leveled off, which we're grateful for. We quit watching flu at the end of May, so we don't have to report on it anymore. And our vaccine expires at the end of June, so we won't vaccinate until next season. And we've had some sexually transmitted diseases the last few months, which is typical of this time of year. And
must be the rush, huh?
It's graduation.
That's what it is, graduation.
You can tell which school graduated. Yeah, a lot of it is related to that. So, and then budget's been a big thing on my plate, especially because federal funding's a little bit questionable. We did have some of the IAP funds cut. I've met with Ginger. We've talked about that. I got an email this week saying that some of the chronic disease funding is going to be cut too. So we don't have chronic disease funding that comes directly to us. We've got an MOU with Lewis and Clark. So I'm not quite sure how that's going to affect us, but it will. It's going to affect tobacco, diabetes, and we do have tobacco prevention here with Nicole, cardiovascular, cancer, disabilities, asthma. I mean, all of that's going to be impacted. So that's kind of sad news. On Friday, I did a follow-up for a foundational public health services assessment that the state started a year ago. They had regional meetings the last few weeks to give us the report on that assessment. I've marked this one up, but I will send you a copy of this in case you'd like to look through it. And it actually asks us to share with our stakeholders. So you guys, I'll be sharing with the Board of Health too. It kind of shows some of where we were, and this assessment was done a year ago. And I feel like some of the things I've been working on, like pathways, have moved our needle on some of this a little bit. I also would like to say that they put Jefferson County in as a medium-sized county because of our population, which creates some issues for me because my FTE is pretty small, so my capability is smaller, and we don't have a hospital. So I think some of our foundational capabilities are impacted by that. I really consider us more of a small county than a medium size. So we're right at the bottom level of a medium, which is from 10,000 to almost 30,000 is what a medium. So I don't see us as in the same category with some of that. So in some of this, where you look at how we compare to a similar size jurisdiction, which is the blue triangles in this assessment, I didn't give that much. So I'll send an email with that to you guys so that you have a copy of it. We did get some good news, funding wise for, we did get that near term initiative funding. So the 250,000 over 2 years. And I meet with the state partners on Friday to kind of look at where that's at. I've given a budget draft to Ginger for that. And we'll start getting funding for that as the task order's been signed. So part of that is as soon as it's signed, we start getting funding so that we can hire a behavioral health coordinator. One of the things they'd like us to do is do kind of a kickoff with behavioral health, and the state is working with the University of Montana's Public Health School and a theatrical group to do what they call a state of mind presentation. And so we had approached Jefferson High a while ago about maybe coming in to do this when we heard about it last year. So the funding only goes till the end of this next fiscal year, so June of 2026. And they declined to do it. And I didn't approach Whitehall High School because they'd had some issues with a mental health and a theatrical performance. But when I saw this workshop presented at the Behavioral Health Conference in April, I was really, truly impacted. And then the state reached out to me and said, with the folks who got near term initiative money, we'd really like them to consider state of mind. Do you know about it? I said, actually, I do. So I went back to Jefferson High yesterday. One of the actors that performs in it is a Butte native, and Mr. Moodry is Butte native. And when I talked to this actor, he said that Mike had coached him and taught him. And so I thought, there you go. And so Mike connected with the actor and accepted the offer to do
nice.
state of mind.
Sure.
So October 8th and 9th, we will be doing a state of mind performance in Jefferson County.
Nice.
So I'll be giving you more information as that comes about. It'll be their actors acting, but it's our people's voices and our resources that we'll be looking at. So that sim mapping we've been doing, this assessment we've done, a lot of those pieces are really going to help us to be able to give some good data to these people so that as they write the script, it'll be impactful. So I was really excited about that. It's summertime, schools are about out. And some of them are out. So Aaron's kind of winding down a lot of that school stuff and starting to work on daycare reviews. This legislature put into effect their new daycare legislation package, which impacts how we do business with daycares and immunization in a negative way. So we're kind of trying to adjust to what we can do and how we do it, because it is a little different now with the new legislation. Which also yesterday I got an email from the state talking about guidance for measles quarantine and isolation. And with some of the legislation that's come through the last 2 years, we're impacted with that too. So we can isolate folks who have measles. We're very limited in what we can do with quarantining people who have measles, because House Bill 702 doesn't let us discriminate with immunization status. So we're trying to work through that. I'm going to send this on to Steve to see if he has any input for us. And I talked with our health officer, Jim, about it. So we're kind of looking at what we can and can't do with quarantine. If we get a case, we're hoping we don't. But the way it's starting to spread, we are preparing as if we're going to. So that's kind of where we're at. still working with Butte Silverbow with the crisis diversion. I need to get them some information about our match. And in talking with them, I can use that sim mapping event and put in salaries for the people that attended. There were a lot of county employees there. And I talked with Ginger, and I'm gonna make her a spreadsheet, and she's gonna put the values in for me. And then I can send that off to them, and that should fulfill our match
Nice,
for that. So
great.
anyway. What
How tough
question?
is it gonna be to find a mental health coordinator?
Mhm.
Do you know how tough that's gonna be? Do you know if they're a dime a dozen or if they're hard to find?
What's that?
The mental health coordinator.
For your
that you
grant,
got?
Oh,
your
yeah.
250,000.
It's a 0.5 FTE. We've designated about $32,000 a year, which is a pretty good salary, be about $30 an hour plus benefits. Part of the reason they encouraged us to do that is that if we get a person with clinical expertise, that's not unexpected. In fact, that's a low salary for them. So
Sure.
kind of puts us in a place where we could maybe get a professional in that, especially to build that
Mhm.
system. I don't know what we'll do with sustainability. That was one of the things we talked about when we did this assessment with our region, is what we need to support public health departments, for the basic needs we need to do, which I said, we need a public health nurse. I don't know how we would do this work, because there's, mandated things we have to do. We need FAP because there's mandated things we have to do with FAP. And we need a health officer. That's also, I said, after that, a lot of things are added. But those are really foundational pieces. And I said, and if I get a behavioral health coordinator, I don't want to lose them.
Right.
So, when we start building these things, it'd be nice if we could keep them.
Mhm.
So I'm hoping that we can, but that's where we're at.
But do you know what kind of training or whatever college do they have to have? Is gonna be a tough one to try to find a person, or is it good?
I have
high
2 or
school?
3 people that are somewhat interested, and no, it can't be a high school person. They really, even more than, they need to have some passion for mental health, but they really need some management
Mhm.
skills
Okay.
to do what we want them to do.
Mhm.
And like I said, I got 2 or 3 people that have kind of shown some interest already, just in hearing about it. So I'm hoping that when we get ready to put that out, we've got some response. I'm meeting with the team Friday, and they'll give me some direction. Another part of that funding is going to Montana Public Health Institute for technical assistance for us with this.
Mhm.
So, they'll be very helpful. They've already given me some samples for job descriptions, and they'll help me get the word out into different avenues so that we can, get it well advertised. So that's going to be valuable to have the technical assistance from the Institute. So we'll see.
Sounds good.
I'm
Sounds like
hoping
you're-
we can find a good, really qualified person. Actually, 2 of the people that have reached out to me do have clinical background,
Good.
so that would be great, especially to get it off the ground.
Have you replaced Megan yet?
What's that?
Have you replaced Megan's position yet?
I actually put it on another board. I asked Kelly if we could put it on another board, because one of the things I have to do for pathways is to show how we advertise for positions. And even though I don't supervise environmental health, it is part of public health, so
Right.
we could use that as a sample.
Mhm.
I haven't hired that many. So I talked to Kelly and said, can we put this on a couple more boards so that I can use these as examples? And she was all for that, so.
Sounds like we've had some people interested, so that's a
Good.
good thing.
Yeah,
Especially for that position.
yeah, I'm nervous about that one. There aren't very many sanitarians, and
No.
Megan will be hard to replace.
Absolutely,
Yeah, she's gonna be sorely missed.
for sure.
All right.
Good. Thank you, Pam.
Thank you.
Thanks. Before we close out, I gotta do these. I'm sorry. I forgot the
Minutes, yeah.
minutes. I've got two sets of minutes with the county health nurse, one dated May 6th, 2025, and then the health insurance update, May 6th, 2025. Would entertain a motion.
I'll make a motion to approve.
I'll second that.
Okay, all those in favor?
Aye,
Aye.
Okay.
unanimous, all righty,
Alright, got it.
thank you.
Here, thanks, Jen.
Thank you.
Anything, give a holler, but everything you've got now that I've signed.
I think you're good,
'Cause I'm sitting there
Dan.
going, oh, I missed this, I missed that.
I know.
You know,
I
kick it
try
back
to give you a notice when you got something that's gonna be coming so that you're.
Right, I
aware.
just wasn't sure who from at that point, and I looked at it, and that's why I kick it to you.
Yeah.
Ginger, so.
Yeah, and do feel free to call me if you've got
Okay.
questions.
Will do, appreciate it, thank you. For the rest of your day.